right, then. So on the first segment of the program, we're trying to understand lower back pain, causes, prevention, and treatment. This is a campaign we started on Monday with our Rjolad Hospital. They are very keen at making Nigerians much more healthier than what we are having right now. And that is why we are embarking on this 4 weeks campaign. Joining me in the studios this morning, Dr. Elijah Afolayan is consultant orthopedic surgeon with our Rjolad Hospital. He's right here in the studios. Dr. Elijah Afolayan, nice to have you in the building. Good morning.
Good morning. It's actually Dr. Akim Afolayan.
Oh, it's Akim?
Akim Afolayan. Yes.
Okay, all right. So it's nice to have you. You're welcome.
Thanks for having me.
Let's talk about this. Now, Monday, we started this campaign by reflecting on the importance of screening for diseases. And one of the very, very common things that affect both genders is the lower back pain. Talk to me about it.
All right. Thank you very much. Good morning once again. I'm Dr. Afolayan, the consultant orthopedic surgeon at Rjolad Hospital in Lagos. So we'll be talking about low back pain this morning. Low back pain is a very common condition in our environment. It's one of the commonest reasons why patients present in the orthopedic clinic. It is said that about 80 to 90% of people will experience this condition in their lifetime. So just as you said, it can occur both in male and in female.
Which is more common, male or female?
It has equal
rating.
Yeah.
Because I'm just having a dialogue with my colleagues in the building, and most of them were females, and we thought that it happens more with women. But you're saying it's on both fronts, right?
Yeah, it's on both fronts.
Okay.
It's on both fronts.
So what causes it?
All right. So there are several causes of low back pain. The commonest of them is called lumbosacral strain. Usually caused by poor posturing, usually for people that lift heavy weights and all that. That put a lot of strain on the back. Also, it can also be as a result of heavy lifting and all that. So all these things can give rise to low back pain.
Okay.
Another cause is spinal stenosis. There are several spaces within the spine which can the spaces can narrow, and with that, it can put pressure on the nerves as well as the spinal cord, giving rise to pain, numbness, and weakness of the limb. It can also be caused by degenerative disc disease, which is commonly called spondylosis. This is a very common condition.
Okay.
And this is usually as a result of aging. In this anatomy of the back, there's what we call the intervertebral disc. That disc is usually in between the two vertebral bones.
All
so
right.
sometimes they get damaged, and when they do that, the patient starts feeling pain and some other symptoms.
Now, damage here means that he has ruptured it, or is it through? How does that come to play?
Yeah, it's as a result of gradual deterioration.
Okay.
As one ages,
so it's not something
it's like a wear and tear process.
Oh, okay.
As one ages, the several structures within the back undergo wear and tear. So they can get damaged, and with that, it can cause pain and other symptoms.
Okay.
So aside that, it can also be caused by sciatica. Some people call this radiculopathy. This is usually as a result of compression of nerves within the back in such a way that the patient feels pain that moves from the back all the way down to the leg, even up to the level of the toes. So that can also give rise to low back pain. Another important cause is injuries. Like some people, they may be involved in road traffic accidents, sporting injuries, or fall. This can cause fractures within the bones of the spine and give rise to pain. Other causes include medical conditions like renal stones, infection of the back, even tumors can cause low back pain.
All right. So in all of this, you've not mentioned anything that relates to diet, because a lot of times when we have that kind of pain, sometimes they say, oh, it's too much sugar, or that kind of a situation.
All right. So that's a myth about low back pain. Excess sugar does not cause low back pain.
It doesn't?
In
any form?
In any form.
Wow.
It's a myth. We should cancel that. It doesn't cause low back pain. But when you talk about diet, it's very important to maintain a healthy weight, because with more weight, there will be more stress on the back, and it can cause, back pain.
Right. So you've given several instances of what could cause lower back pain. In all of this, Dr. Afolayan, what signs, what symptoms will one begin to see or notice that will indicate this is a recurring lower back pain?
Okay, so the of course, the commonest symptom is the pain in the back, usually in the lower back region. There may be other associated symptoms like numbness. There can be tingling sensation in the limbs. In certain situations, when it becomes very worse, there can be pain at the back of the leg, which we call intermittent claudication. There can also be weakness of the limb. There can be sensory disturbances. But the primary symptoms usually that pain. And once you start having that kind of pain, it's very important to come to the hospital to get yourself checked by the doctor so that you get evaluated so as to know the cause, and that will help us to determine the treatment.
Okay, yeah. So major symptom that what we see is that you begin to feel pain at that lower region, right?
Exactly.
Now, any connection between the lower pain and the waist? Because sometimes we tend to use them interchangeably.
And lower back pain is actually
is the waist.
Yeah,
okay.
It's that waist region. So the doctor will ask you to point to where you are feeling the pain, so as for us to be in the same. Yeah.
Right.
So it's lower back pain is.
So this pain is at the center or the edge?
It could be at the center. It could be at the center of the spine. It could be at the paraspinal region. So that is low back pain. So if it's at the flank, one may be thinking of other things. So if it's at the flank, maybe thinking of renal stones, kidney stones, and all that. Right. But the doctor will have to do that, examine, know where the pain is coming from, and arrive at the cause of the pain.
All right. So is it treatable?
Yeah, it's treatable. It can be prevented and can be treated. In terms of prevention, not all of the causes can actually be.
So before you even talk about that prevention now, Dr. Afolayan, so can one go through life without back pain? The lower back pain to be precise?
Yeah.
From age 1 to 80, 90, is it possible? It's totally impossible, right?
Yeah, more likely impossible, but it's possible. It's possible, but just as I said, 80 to 90% of people will experience back pain in their lifetime. So most people will experience back pain in their lifetime. So,
okay.
Yeah.
All right. So now you said it's preventable.
Yeah. Okay. Not all the causes of low back pain can actually be prevented. However, there are some lifestyle modifications that can help to reduce the risk of back pain, like maintaining good posture as much as possible. So it's advisable to avoid slouching, avoid bending in a very awkward manner. All this puts a lot of strain on the back and give rise to back pain. Aside that, it's also important to maintain good weight. Just as I said, when one is on the big side, it puts so much strain on the back and can give rise to low back pain. Also, if you have to lift any object, it's very important to lift it properly. And how do you do that?
How do we do that?
So ensure that you bend at the knee, not at the back, and ensure that whatever you are carrying is close to you. With that, you are relieving the stress on the back and putting more of the weight, in the lower limbs.
Right.
So that is very important, because even by bending awkwardly alone, that can cause a lot of strain on the back and give rise to low back pain.
Now, if carrying heavy things causes lower back pain, so what would you say to sportsmen, all those weightlifters? Are they going to come down with back pain later in life?
Well, there's a particular way that they carry weight.
Oh, they are trained?
Yes, they are trained. And if you look at their own personal weight compared to what they carry too, you can't be a very small kg individual and be carrying something very big. That can actually cause serious injury. So they know the amount that they can carry, depending on the individual's weight.
Okay. Yeah. So that is what. So you said that back pain is treatable?
Yes, it can be treated. There are several options of treating back pain. Actually, the treatment depends on the cause as well as the severity of the pain. So the options include, for acute back pain, patient may need a short period of rest.
Okay. So
rest is a form of treatment. That is one. Two, there are several medications that can be used to treat back pain.
Right.
Also, physical therapy, what we call physiotherapy, is very, very important. It helps to, strengthen the core muscles. It helps in management of back pain. Also, steroid injections, especially for patients that has sciatica and radiculopathy. We can deposit steroids in those species to control back pain. Also, in situations in which all these conservative measures are failed, or in situations in which the severity of the back pain is on the high side, surgery may be a good option.
Not be applied.
Yes.
Okay. Now, is it possible? do we have situations whereby this back pain lead to a situation whereby you are not able to really get up and walk again and you are confined to the chair?
Yes, it's very possible, because most times, especially if it is caused by what we call the degenerative disc disease, it can be a progressive condition. You understand? So if it can progress to that level in which there could be compression of nerves as well as spinal cord, it could even cause paralysis in certain situations. But it's not every patient that will get to that level. And also, because of the severity of the pain, sometimes it can confine, an individual to bed, just as you said.
Wow. So it could possibly, but one can recover from it totally?
Yes, one can actually recover from it.
It can be healed, right?
Yes.
All right. So let's see. Where does our Rjolad Hospital come in all of this for lower back pain and treatment?
Okay, so Rjolad Hospital is a multi-specialty hospital that has, we have an orthopedic department that is specialized in management of low back pain and other musculoskeletal conditions. So apart from low back pain, pain in the joints, arthritic pain, deformities, anything that has to do with bone infections, tumors, and all that. So we try to make diagnosis and treat. So we have a state-of-the-art facility that includes a digital X-ray, CT scan in making this diagnosis, and we have personnel. Apart from orthopedic surgeons, we have neurologists, we have physiotherapists, occupational therapists, which we try to work together and ensure the best treatment for these patients.
All right. So do we have any form of testing that should be done to ascertain the status of the spine or perhaps the lower back region that would indicate if you're likely to come down with any back pain? Are there any screenings that can be done for that?
No, there's no screening.
There's no screening. It's only when I'm suffering some kind of pain that I will show up.
So the best thing is to actually just prevent, if there are all those lifestyle modifications. So
all right.
Just try and stick to them so as to prevent.
Let's just run through that again. What are the things that we need to do to prevent lower back pain?
Okay, so to maintain good posture, maintain healthy weight, to lift properly, to exercise regularly. It's very important to exercise regularly. It helps, in preventing low back pain. Also, it's also important to stay active, especially for maybe office workers that has to sit, for a very long period. Mm-hmm. It's advisable to take regular breaks to just move around, stretch the body at intervals. It's very, very important. Also, use of ergonomic chairs is very important.
Ergonomic chairs?
Yes, ergonomic
like these
chairs.
Ones?
Yeah, these ones are ergonomic chairs. Chairs that have support for the back. It helps to support the back and keep you
it's very, very good.
Sitting straight up.
All right. So, what's your advice now, even as a round off for the program? Drivers, our immediate constituency, they are always on the road. We have those that are driving for living. What would you advise them? I mean, they are always there morning till evenings.
Well, it's a source of living. You won't tell them to stop driving. So while driving, is very important to sit straight up for most of the journey. And some of these chairs, even the chairs in the car, they are ergonomic chairs that help to support the back. But in the absence of that, there are prefabricated lumbar supports that one can actually put at the back. Okay. Or some people modify and use pillows just to support the back. And if an individual or a driver that drives a very long distance, it's good to take regular breaks, stop the journey and,
all right.
stretch the back.
All right, so which is very good. So for those who want to connect with our Rjolad Hospital, what's the contact?
Okay, for the contact, the website is www.rjolad.com. You can email us at wecare@rjolad.com. And the telephone number is 0700 756 523.
All right, we'll leave it to that for now. Thanks for being here. Thank you so much for being here, Dr. Dr. Akim Afolayan. Thank you.
You're welcome.
Okay,
Thanks for having me.
He's a consultant orthopedic surgeon with our Rjolad Hospital. And on this second episode of the program, we'll be able to reflect on lower back pain, causes, prevention, and treatment. A brief break. When we return, we'll do our birthdays before we switch to the Greater Lagos Summit, which comes up shortly.